Introduction. A computed tomography scan, commonly called a CT scan, is a non-invasive medical imaging technique that uses a specialized rotating X-ray machine connected to a computer to obtain detailed cross-sectional images of the tissues, bones, and blood vessels. A CT scan is a painless procedure which lasts around 15 to 30 minutes and can be performed on any part of the body. Indications. CT scans are indicated for the following: identification of various musculoskeletal disorders, such as tumors and fractures, as guidance for medical procedures such as radiation therapy, biopsy, or surgery, to accurately locate infections, lumps, or blood clots within your body, to detect internal bleeding or injuries, to identify the presence and monitor conditions such as heart, lung, or liver diseases, to determine the progress and effectiveness of various treatment methods. Preparation for a CT scan. Preparation for a CT scan usually involves the following. You will be asked to change from your regular clothing into a hospital gown. All metal and electronic accessories like a watch, jewelry, belt, dentures, etc. should be removed, as metal in these objects might interfere with the CT scan. You will be advised to avoid eating or drinking anything a few hours before the CT scan. Inform your doctor if you are pregnant or think you may be pregnant. You should also inform your doctor if you have any allergies or suffer from any heart, liver, or kidney disorders to avoid reactions to the contrast dye. Procedure for a CT scan. A CT scan is performed as an outpatient procedure and involves the following steps. You are asked to lie on the procedure table connected to the CT scanner. Contrast dye, if needed, may be given to you orally or injected through an IV line connected to your arm. Suitable care is provided if you develop any allergic reactions related to the dye, such as sneezing or itching. You will be able to communicate with the doctor or technician through the speakers attached to the CT scanner. CT scanners generally resemble a large donut with a motorized table that slides in and out of the scanner, with straps and pillows to comfortably prevent movement during the test. For head scans, you will be provided with a specially designed cradle attached to the table to hold your head in place during the scan. As the table moves into the scanner, the detectors and X-ray tube revolve around you, forming several images of thin cross-sections or slices of your body during each revolution. There will be buzzing noises that indicate the scanner is doing its work. In some cases, you may be asked to hold your breath for a few seconds during the image capturing process. Once the procedure is completed, the IV line is disconnected and you are allowed to go home. The results will be sent to the radiologist to read and a report sent to your doctor to discuss with you. Post-procedure care. You are allowed to return to your regular activities once you are done with the CT scan. You may receive specific instructions on food and drink when a contrast dye is used during the test procedure, such as drinking plenty of fluids to flush out the dye from your body. Risks and complications. Side effects from CT scans are very rare and may include allergic reaction or kidney problems due to the contrast dye. Risk of developing cancer from radiation is rare, but increases with multiple scans. Summary. A CT scan is a diagnostic imaging procedure that generates detailed images of your blood vessels, soft tissues, and bones. It is a quick procedure that is performed on an outpatient basis to detect tumors, fractures, blood clots, and internal injuries in your body, including heart and kidney disorders. A CT scan is very safe with minimal risks and side effects.